welcome to the Pause It podcast. I'm Dr. Sam, and with me today is Dr. Robert, as always.
Welcome back, guys.
Well, we're really excited to talk today about heat cycles in small animals and kind of explain what that is. We said we would be starting with the things that are really commonly Googled questions that people have. And this is one that comes up a lot. Every time I was looking up things that people are curious about, when animals go into heat, things that are important to know about heat cycles. And this is a great topic, I think, when you have, a primary care doctor and then an emergency doctor as well, because there are so many things that are really, really important that you take into account when you have an animal that goes into heat and what can be surrounding that. So both from a primary care health status type thing all the way to the emergency type of situations.
Yeah, and I think the biggest thing people need to understand is that beginning care with your primary veterinarian is such an important thing to saving you a lot of money later on because of the repercussions of if your pet has something like a dystocia, which means they aren't having a normal birthing process. So that happens a lot, and especially breed animals or certain breeds of dogs like French bulldogs.
I was going to
and
say
English
bulldogs.
Yep, bulldogs, they're the kind of the poster child for this
Yeah.
one. But those are things that's really important to follow up your primary vet in the very beginning, because taking x-rays beforehand can save you a lot of money later on when we can take them. We want to see how many puppies are in there. We don't know because we have maybe 2. Are there 4 more still in there? And we just don't know. So that's the type of information that we like to know long term, but we'll get into that at some point. So
yeah, well, so I think maybe the easiest way to do this might be to kind of start at the beginning, right? So you get a new dog. I'm going to guess for the most part when we're talking about heat cycles in dogs, we're starting with a dog that probably is a puppy, right? I mean, that would be the guess. There's probably rare circumstances where you rescue a dog that hasn't already been spayed or neutered. And we'll definitely get into that a little bit too, because there are some things to think about with that, that we can touch on in a minute. But I think for the most part, we're going to be talking about puppies, right?
Yeah, I think puppies are the big focus because
and kittens too.
Yeah, exactly. So when they hit maturity and whatnot.
Exactly. So I think one of the first things that we'll talk about is, well, what is a heat cycle? I mean, that is probably the most important thing, which actually somebody asked me the other day. And I think sometimes when you're a veterinarian, you take for granted that people just know what these things are, and you're like, oh, well, they're going to go into heat. And they're like, well, what's that? You know what I mean? And so it's interesting when people ask you that, because you're like, oh yeah, I guess that, let me explain that to you.
And you had a funny story about that the other day, actually, I think.
Which one?
About someone asking about a heat cycle and what it was. And
oh yeah. Well, and it's funny too, because it was a woman that asked me what a heat cycle was, and I was kind of like, well, so
you actually have one too.
Yeah, exactly. It's a little different though, right, for people versus animals. And so obviously puberty happens a lot faster in our small animals. You got to think about their first year of life is almost like our first 13 years of life, right? I mean, you're going to go all the way from being a baby, pediatric, to then going to sexual maturity. And so when that happens for our females, they start having a heat cycle, and that's when they are going to be able to get pregnant. That's the time where they are receptive to getting pregnant.
Exactly. And we'll touch on cats very briefly in here, because most of this will be about dogs, just because cats don't have as many problems most of the time. Very briefly, cats are induced ovulators, which means that pretty much they can get pregnant at any time. That's really what that comes down to. So
exactly. As early as 4 months too. I mean, they can get pregnant pretty soon. And we usually, in our primary care practice, we're usually recommending around 6 months for our cats. Truthfully, I usually say if they're over 5 pounds is probably fine. Majority of cats
with regards to spaying and neutering them.
I'm sorry if spaying.
Oh no, you're good. I was curious, actually I didn't know that myself, because I don't have that conversation with people anymore.
Ever, right? Yeah, right. It's true. And the fact is, actually, when it comes to kittens, it is kind of rare even for me, because so many of them are rescued, and a lot of rescues do what are called pediatric spays or neuters, which basically means they are spaying and neutering them well before we'd ever even talk about it in our primary care practice. And I think the most important thing to think about with that, because people ask like, oh, is that going to be a problem? Should I be worried about that? And you have to remember that in the shelter setting, so in that sort of setting, their goal is population control.
100%.
My goal is individual health. So I'm going to have a different conversation with my owners than the people who are trying to keep there from just being unwanted puppies and kittens are going
Oh
to have,
yeah.
right?
Yeah, and especially with having dogs too, that age that you neuter or spay them for that matter, like even male dogs, they need testosterone to close their growth plates. And you'll see some dogs in the shelter actually have really long legs because they've been neutered really early and they don't have
Mhm.
that testosterone that they would normally have at sexual maturity to help close their growth plates on time. So, those hormones are very important. We don't know all of the effects of them, unfortunately, just
Yeah.
yet. But that's why it's really important to listen to your primary veterinarian. And, if it would wait a little longer, great, but you don't want to wait too long because of a lot of other things we'll talk about today.
Yeah, yeah. Well, and I think that that is one of the biggest take homes, right? Is that there is no really simple answer anymore. It used to be 6 months, spay neuter 6 months.
Yep.
And I think the more information that comes along, the more we have to individualize our care. And I think that's why it's so, you started the very first thing you said was have a relationship with your primary care veterinarian and how important that
Mm.
it is that they know you, that they know your puppy, and that you guys can have a real conversation. How likely is it for them to get out of your backyard and roam around? How
Yeah.
likely is it for them to get pregnant? How likely is it, for kind of a whole host of things that can come along with, well, when do you spay, when do you neuter, and
Mm.
how comfortable are you with them having a heat cycle in the case of a female? You know what I
And
mean?
that's big because I can't tell you how many people come in and they've got diapers on their dogs, they're in heat cycles, or it's really annoying to them
Mhm.
and they wish they'd done it sooner. But we
Yeah.
don't usually recommend a healthy dog spay or neuter when they're in their heat cycle. We usually try and wait until after it's through. So
Yeah,
if
and
they
there's a
can't deal
really
with it,
good reason for that. I'll just touch
mm,
on why,
yeah,
because I
yeah,
because we because I'm the same way. I mean,
mm,
we really will have a conversation with every person. I do try to feel people out, and I'm always like, how would you feel about your dog going into heat?
mm,
What does that feel for you? Is that something that you can be comfortable with, and kind of explain what to expect? Which there's a variable thing to expect. Like some dogs go through a heat cycle and their vulva gets a little swollen, but maybe drops of blood a little bit, but hardly have any sign of it at all.
yeah,
And some dogs really will leave, a little bit of blood and stuff like that. And, they can act a little funny too. So I think some people are just like, absolutely not. That's not happening in my house. In which case, then, we have to try to balance their comfort with the recommendation not to just reflexively spay and neuter them at 6 months, especially if
mhm,
it's a large breed dog. Maybe I'm going to try to push it to say, hey, like 8 or 9 months, then let's try to see if we can get them spayed at that time. But with what Robert was talking about is if they're in a heat cycle and you go ahead and you spay them, number one, they're at a higher risk of bleeding.
okay. Yeah,
Huge.
that's huge.
Um, yeah, but also then they can have a false pregnancy. After you remove those hormones right in the middle of what's happening, it can really set off a cascade that can be really troublesome for the dog and the owner. It's not, as long as they don't have one of those complications like bleeding or something like that, which can certainly happen, is more likely to happen
Exactly, and
if
this makes the surgery more challenging,
much more.
for everyone, for your pet for recovery, for your veterinarian during the surgery, so it's just easier to avoid, and that's why it's really important to have that conversation early on about when is the best time and if you're comfortable with it. I think those are
Yeah.
2 very important questions that you hit on, and
Oh
I
yeah.
highly
Yeah.
encourage that.
Oh yeah, absolutely, absolutely. And then I always tell people 9 weeks. What do you tell them after they've had a heat cycle?
Honestly, I, haven't had that conversation with someone in a long time. Usually, most of the time, it's they have an accidental pregnancy on my side of things, and
Yeah.
that's a big thing to keep in mind. Maybe part of the conversation in the beginning is, do you have other pets in your house that are not spayed or neutered? Because if they're older, and then your newer pet becomes in sexual maturity, and then now they're capable of having puppies and kittens, then you might have a lot more puppies and kittens very soon, if you're not careful. So having that conversation early is important.
Yeah, and I do think it's not like if, it's when.
Yes, yeah,
So
yeah.
I definitely will have that conversation with people for sure.
Mm.
And the other thing I usually tell people, because I do have a lot of people coming in that like the idea of possibly breeding. And so I kind of have a thing I say, right? Which
I'd like
is
to hear yours because I have my thoughts on breeding once stop breeding.
yeah.
But
Well, I mean, and here's the thing. I mean, if you're breeding for the right reasons, if you're trying to improve the breed, if you're trying
mm,
to do things that are really positive for the breed, if you're taking the time to make sure that the dog you're breeding is also healthy and sound and isn't passing on any genetic issues that we don't know about at this point in time. Yeah, they're a lovely dog. They're very, very
Mm,
cute, but
yes.
very, very cute is not usually a really good reason to breed a dog. So
Yeah.
in my opinion, and I know
No,
Robert and I speak
it's
only
very
for
true.
ourselves. We don't speak for everybody,
Yeah.
um, but I do think people really don't understand what can happen if they aren't prepared. And you'll be able to speak a lot more to that part of things, but basically what I tell people is wait until they're at least 2
Mhm.
because you really need them to be mature enough, and able to be healthy enough to have those babies. Just because they can get pregnant doesn't mean they should get pregnant.
Yeah,
But
the younger
also,
mothers definitely have a harder time. I've seen that the young ones are accidental. They have a
mhm,
lot harder time. We'll talk about the stages of when they're getting ready to have birth, but that first stage is longer usually, and it's a little harder on them. So I definitely, yeah, sexual maturity waiting till 2 years, I think is a great idea.
yeah, I mean, it's good to know because I actually rarely ever see that part of it. Do you know what I mean?
Mm. Yeah,
That almost always happens when I'm closed and he's open.
yeah. I see a
Which is
lot
what
more
I
of the
tell
ones with
people
accidents.
too. I'm like, "This isn't gonna happen when you can call me. It's gonna happen when you have to go to an emergency clinic."
Mm.
Almost always, it
Oh
seems.
yeah,
And, um, and then I also, want people to, make sure that they've given it enough time for some of those genetic issues that might come up, allergies or even some orthopedic things. Um, they really do take a good couple of years before they start to show
yeah,
themselves. Not all of them, you know what I
yeah.
mean? That's true. Some of them come a little later, but certainly if you cannot pass those things on, you really shouldn't.
Well, things like hip dysplasia. When do they start testing for? Like, I don't do the testing for it. Do you know when they start doing the testing for it offhand?
So it really depends on which one you're talking about.
Okay.
So if you're gonna do probably the best test, I guess, would
Mm.
still technically be the pen hip, and
Yeah.
that you can do before 2 years of age.
Okay.
But you have to have like the actual right equipment to do it.
Okay.
You can't just sedate them and do it. So there are definitely changes you can see, I believe, before 2 years old, but generally, like OFA and stuff like that, which is the Orthopedic Foundation of America that does a lot of the testing for breeding and stuff like that. Just as an aside for people who don't know what OFA is,
No, that's
um,
good.
but they're usually saying two is I think where
Okay. That makes I think
um,
so. I remember from school. It's just been a while since I had
truly,
that
I don't do
conversation.
a lot of breeding, right? That's the other thing too,
Yeah.
is that if you think you're gonna breed, you should go to a veterinarian that does that. I am not one.
Yeah.
I try to encourage people to spay and neuter, and if they are going to be breeding, then they probably should go to a doctor that does
Yeah,
a fair
because
bit
there are
of
veterinarians that
breeding.
do specialize in that. There are definitely veterinarians that are
Oh,
really
yeah.
familiar with the reproductive cycle. They handle a lot of patients, especially like the ones that may be a little more challenging as
Mhm.
well.
Yeah.
I'll caution people in terms of always listen to breeders. They have a lot of great information. They really know their breed well, but every dog is different just across the board. So having a person who sees a variety of breeds
Mhm.
and knows the challenges kind of associated with each one is like, be a little more familiar with like the heat cycles and just kind of the normal processes.
Well, and
So
understanding the hormonal changes and the things that can happen that aren't
mm,
just routine breeding types of things, and I think
exactly.
that's what veterinarians are there to be a partner for if you're gonna do that sort of
Yep,
thing.
exactly. So, yeah,
Um,
definitely things to keep in mind as you breed your dogs.
yeah, and so I usually tell people, so part of my spiel, going back to that, is, that, I say, "Hey, there's a certain amount of money that you probably should put aside. If you think that you are going to be breeding, you have to have money in case they can't give birth." So what Robert was talking about right at the offset was what we call dystocia. So it's when they aren't able to have a baby without assistance, basically. Something's happening,
Yeah,
something's gone wrong, and it's an
and there's a lot of
emergency.
tests that come with that. It might be because they don't have enough calcium in their body. It might be because the puppy's too large. Um, Maybe because the mother's not quite ready yet. There's a whole bunch of details that go into it, and it involves us taking usually X-rays and doing blood work. And walking the door most places, you're going to spend $600 just trying to get some of that information, sometimes more.
Yeah.
And that's
Especially if it leads to a
yeah.
C-section. I mean, just
Oh
like
yeah,
what
you're
happens in
spending about
humans.
6 to 8 grand then for a C-section in some places. So like Depending on where you go. Like I'm in San Diego, so my prices are probably a little different just because of that. But
Right. And
I'm
in
sure three to
Indiana,
four.
it definitely wouldn't be as high, and that's where I am. So,
Exactly.
but
Probably
you're
more three
still
to four,
talking
maybe.
a
Yeah.
few $1,000s
Yeah.
or having to
Exactly.
make a really tough decision. And I think
Yeah.
people think, "Oh, I want a puppy." And they don't think what could happen to my dog if I can't afford to do that, you
Exactly.
know?
And you can do everything right sometimes and
Mhm.
still have a couple puppies not make it or all of them. And that's the reality of it, which is
Yeah.
sad because I think people anticipate, and I think this is true for human medicine as well. I don't think people realize the number of like miscarriages that people actually have
Yeah.
just in human medicine.
Or
The same is true for
yeah,
dogs.
it's true.
There's quite a few puppies that sometimes will not make it, and it's not like you get you batting 100% at 12 for 12. It's
Mhm.
you'll sometimes lose a couple on the way, which is it's sad, but it's just normal,
Yeah.
unfortunately.
Yeah. It is very, very hard. And I think that, we understand that. So it's just part of something that we understand. But when you're in the situation and there's emotion, it is, you just really want to avoid that for people. And so I really do try to make it very clear to people that it's not that I don't think you should breed your dog just because I don't think you should breed your dog, but really because I don't think you're fully aware of it. When it goes great, that's great. But when it goes bad, it can be really, really bad. But then
Yeah.
the other thing too is, well, then sometimes people think, well, maybe I'm going to breed, but maybe I'm not. And so months go by and then years go by. And then
Hmm.
they've had 2, 3, 4 heat cycles. And now their risk of getting mammary tumors is much higher than it would have been had they just spayed them in time. So I do make it very clear to people that there really is health benefits that are very, very tangible, very, very real, that if you aren't going to breed them, go ahead and
Hmm.
get them spayed for
Yeah,
sure.
yeah. The mammary cancer is a big one. I think their risk of mammary cancer goes up like exponentially after the first heat cycle. So
It
it's really
does.
important. Like
It does.
I can't remember the statistics off the top of my head, but it's high. It's like 75% of something like that after the first cycle. It's like
So
maybe it's not that
no,
high.
not quite that high.
That's
So
really
so
yeah.
when we were first in school, Robert and
Hmm.
I went to school together.
Yeah, way back when.
I remember learning that it was something only just like still about 99%, effective. But then I was just reading recently that it's a little more like high, like 7%.
Oh,
So it's
good.
not,
Oh,
it's not
really?
quite
That's not bad as bad.
30.
Oh,
Yeah.
see, I remember that being way higher. So that's good. That's
Well,
a really
but
good
that's
thing.
some of that I think is coming along with some of the research that they're doing, where they're
Hmm.
really looking into finding that perfect spot because like what Robert mentioned even in the beginning as well about the growth plates. There are certain breeds. So depending on the breed we're talking about, sometimes it is
Hmm.
still appropriate to do 6 months. Small breed, one
Exactly.
that doesn't have a lot of orthopedic issues, we're still going to say, hey, there's really no benefit to keeping them intact past 6 months. They get their full adult teeth. We can see if any need to be pulled while they're under anesthesia, which is another
Hmm.
benefit to spaying them early is when they have, extra baby teeth or something like that, that
Yeah.
can cause crowding in the mouth and problems, which have nothing to do with reproduction, but a lot to do with those little tiny mouths being healthy for the rest of their life. So it's something
Yeah.
else that we do when they're under anesthesia. That's kind of an aside. Um, but for some of our bigger dogs and our giant dogs, we're really talking about the health benefits for them, letting them get to their full musculoskeletal maturity before we're
Hmm.
removing those hormones from them. And there's different recommendations for different breeds. And so for real, you should talk to your vet about, hey, well, my Great Dane probably shouldn't be spayed or neutered at the same time as my Chihuahua.
Hmm. No, I agree. And I think the best similar, I think we've touched on it a couple times now, is just imagine if you were having a baby. You're not going to, hopefully, in most cases, sometimes accidents happen, but most of the time you talk about it, like, are we ready to have a baby yet?
Hmm.
Like, these are the type of conversations you should have. Are we in a financially good position? Is it a good time for us to have a baby?
Hmm.
Same really should be for your dog. Like, are we in a good financial position to have a dog with puppies? Do we have the space for it? Do we have the resources for it? Those are all important conversations to have with your vet ahead of time because it's kind of like a co-parenting situation. They're
Yeah.
going to be your co-parent for a little bit, may not do as much work as you are obviously are, but they're going to kind of be there along the way and make sure you're doing the right things.
Yeah. Oh yeah. And it's a shame when people do have to make really difficult decisions based on cost solely because
Mhm.
they weren't aware that that
Yeah.
really could be an issue.
Yeah.
And the other thing too is with a dog, you don't have up to 10 months to figure it out.
No, you
You
don't.
have
They,
you have 63 to 65 days to figure it out about.
exactly.
And that's
Yes.
that's how long they're pregnant for. It's pretty quick actually.
Yep. It's very quick. And I think just a small thing to add on to that is, another reason to like spay and neuter your pets. Other dogs know when your female's in like in heat.
Mhm.
And part of the reason that we see a lot of dogs actually hit by cars
Yeah.
is because they're intact and they know a female dog in the neighborhood's intact. And
Mhm.
they're sniffing around, they're running away. And I've seen a lot of dogs hit by cars for that reason alone. So one more reason
Yeah.
to,
Well, no, it's
get your dog
actually
spayed or neutered.
I think one of the most common reasons why intact males are found either hit by a car, like you said,
Yep.
which is awful, or they're found in the shelter, like you know what I mean, like they've been just found roaming on the street.
Yeah.
Even people were like, "Oh, I had a fence, they jumped the fence." I mean, they want to get
That's
somewhere, they're
how I
gonna try
got
to get
lucky.
there.
He was a stray that was intact,
Yeah.
and I'm sure he was looking around at the time.
Oh
So
yeah, he's looking for a girl.
yeah, well, that's not gonna happen for him anymore. So
Right, right. Yeah, Loki's a bit past that part of his life, huh?
yeah. Yeah, I think Dr. Jason Dillman Jersey for neutering him back in the day.
He
Shout out
did
to
it?
him. Yeah, actually, his
Wow.
wife did. Sorry, his wife did it, but he
I
helped
was
me
like,
kind of.
"We were in school."
No, no, no. His wife did it, which was she was very lovely. So shout out to
I
him.
didn't know that. Oh, those are
Mm,
a classmate of ours and his wife who
yeah,
graduated 3 years before us, maybe?
yeah, 3 years I think
3 or 4?
beforehand. So
Yeah.
yeah, it was a while. But yeah, I was like, I'm not doing it myself because the last thing I want to do is see my mistake for the rest of my life.
Yeah.
Same reason I didn't take his
I
eye out.
neutered Gus.
That's because you have more moxie than I do. So,
His incision was
so
beautiful.
I have no doubt. So
But
I
I
can
did
handle other
wait.
things.
I will say, I did wait, and I
Yep.
followed the guidelines for I have a Labrador Retriever, and, it's interesting because when I was reading the guidelines, I thought it was pretty surprising that the recommendation was to keep females intact all the way to a year, but males
Hmm.
had a little bit less,
Okay.
concern, which I thought was odd, and I still kept him intact. Um,
Yeah, I'm
he
surprised
was
by that.
I was too, just because you think about how many ACL tears you see in labs,
Yeah,
right?
so
Yeah.
many all the time.
And I guess we're getting off topic real quick. We should
Yeah.
say that there is definitely some correlation to neutering or spaying your dog too soon and orthopedic injuries and certain orthopedic cancers as well.
Mhm. Yeah.
Yeah, so that's definitely a big thing I talk about with my patients. And so one of the last parts of the female conversation that I have, and then I'm sure Robert will run with this one, is if you choose not to spay your dog, every when they get older, we worry about a month after they have their heat cycle,
Mhm.
they can get a pretty wicked infection, and it's called a
Yep.
pyometra. And why don't you tell us a little bit about that, Robert?
Yeah, it's not a pleasant infection. It's something that you'll see your dog oftentimes like drink a lot beforehand. They'll get more lethargic, and all of a sudden they're seeing me in the middle of the night. Unfortunately, you might see some discharge from their vulva, unfortunately, and that usually means they have the infection. And it's usually a quick scan we can do when they get there to confirm things, but it does require surgery. A lot of owners will ask, like, will antibiotics work for this? And the answer is no. It's like going to war with a BB gun. Like, you'll be the first one out. It's not enough. So you need to bring the heavy hitters, take out the infection, because otherwise it's going to sit there and make your dog very, very sick. But a lot of owners don't expect that expense because it does happen randomly. And I think that a lot of the tough things that we see is that owners have really healthy pets otherwise. And
Mhm,
they're doing great, but then let's say they hit like 10 or 12 years old much later,
mhm,
but they're still otherwise very healthy. And they get this infection, and it's a lot of times the reason they're put to sleep because it's a big infection or a big surgery. They don't want them to go through it, and it's a big expense, and they're an older dog. And normally the dog would have lived maybe 2 more years afterwards because it was really doing great otherwise.
mhm.
And it's kind of a sad thing to see every once in a while. So I definitely encourage you, if you're not breeding them and they're definitely over a couple of years of age, at the very minimum, go ahead and spay and neuter them because there's no reason at that point. There's prostate cancers you worry about, and I'm getting off track. But yes,
No,
lots of things
no,
to avoid it.
but you're right, because that's a huge thing that people ask me. Well, they're already 4, they're already 5, they're already 6. Should I still do it? I'm like, yeah, because
Mhm.
if you can avoid a pyometra for your dog, if we can plan to spay them when they're doing well clinically. The problem is a lot of times people don't realize and okay, yeah, maybe they are drinking a little bit more. I'm just gonna wait.
Mhm.
And it's not usually until they're systemically sick,
Yeah.
which at that point now you have to stabilize them. You have to get them well enough to get them through the surgery and then sometimes even keep them hospitalized after the surgery because
Yeah.
now they've gotten really, really sick. I mean,
Mhm.
every once in a while you get lucky enough to get one that you can just get it out and they're better, but I feel like so often they're sick.
It's very rare you get them early on. I can't say I've seen many. It's most time it's they're 3 to 4 days in, and they've been a little tired, and maybe they missed a meal yesterday. And my dog misses a meal here and there, so I don't blame owners for missing it. Like if Loki missed a meal, I'll be like, yeah, it's fine.
Well, he's a
He'll eat
husky.
tomorrow. Exactly. He's a husky too. But
Huskies
like a
just don't
lab,
eat for a day.
yes,
That's normal. If
yeah, but
Gus
just like
missed
a
a
lab or
meal,
beagle.
I'd be like, "What?"
Yeah, it definitely changes for the breed.
Yeah.
But those type of things are important, like just like
We
the little
talked
things
about
you may
that
not
last
notice.
week, actually.
That's because it's important. Know
Right.
your breed.
Mhm.
Definitely, there's some very distinct breed differences that even I pay attention to. I'm sure Sam does as well when they
Yeah.
come into the clinic.
Oh,
So,
yeah, for sure, for sure.
but yeah, avoid it just when you can. I know it's hard to remember, but neuter or spay them if you're not planning on breeding them anymore. It's safer for your pet. It's better for
Mhm.
you and better for you financially too. I promise.
Oh, yeah. And then I will say it is good to know when you have rescued a dog that if they had been bred, or if they had had puppies, or even if just they were not spayed and then they were
Mhm.
4 when they got rescued. Because I just had one, literally today that has a mammary tumor, unfortunately. And I
I'm
was like, "Did
sorry.
you rescue her?" And she said, "Yeah." It's like she was spayed a little later. Yeah. And she didn't
Mm,
know that that's what that was.
yeah.
And so I do try to counsel people, hey, all these nipples, they all have mammary tissue under them. Get to know what it feels like. Feel that. Women give themselves breast exams. It's the exact same thing. And
Yeah.
anytime you feel something that feels hard, like a nodule, if we can get it off and we can get it off fast, they're slow to spread. We can do that before it becomes something that's then a big ulcerated, angry, infected thing that maybe Robert then has to see.
Yeah, and that tumor does spread every once in a while to the chest as well. So like it's something again, it is slow, which is nice,
So,
but just
yeah.
something you want to pay attention to it because
Well,
it
that's why
does
I'm saying
sometimes.
when they're this
Yeah,
big.
exactly.
When they're
Get to
this
them
big,
early.
then
Yeah, yeah, they get big very yeah, definitely get it done early. It's
mhm.
always better to even if you're like not that worried about it, just have your vet check it out. They can always take a sample of it. But yeah, give yourself mammary exams, give your dog mammary exams too. They'll help
Yeah,
you out in the long run.
it's really true. Um, I think a quick just chat about cats.
Yeah.
Have you ever seen a pyometra in a cat?
I have not. They are very, very rare. Like honestly, the last 7 years a year, I've never seen a cat have a like again dystocia or have difficulty having birth. So it doesn't happen very often.
Yeah, I actually had one ever, but I'm
Oh,
always the
really?
one that's gonna have one weird thing, always.
The one weird
And
one.
this cat totally defied everything I've ever known to be true of anything. This cat had 2 kittens,
Okay.
and one of them died in utero,
Yeah.
and the other survived, which
Hmm.
I thought was crazy. But I,
Yeah.
I kept checking it, ultrasounding until we got all the way, and that kitten
Hmm.
had a heartbeat the whole way through. The other one, and then she went into labor, and she just never could have the kitten, and I had to do a C-section on her.
Really, that's great. Was it a specialty breed cat? Do you remember? I was like, it wouldn't shock me, but it just yeah.
It was such an odd situation.
Hmm.
She wasn't like obviously something very
Yeah.
unique or any. I thought she was just domestic short hair, but yeah,
Yeah.
I've had one, and I still couldn't believe it. I was like, how this kitten survived when the other one didn't.
Yeah, that's
I
weird.
w- I- Cats.
But I guess yeah, every once in a while, I see a couple because like a lot of times, as Sam mentioned, when they come in, you'll scan their hearts. You can actually see the puppy hearts, and you usually want to count their heartbeats because if they're over a certain amount or under a certain amount, that means they could be in distress or
Hmm.
needing to come out sooner rather than later. And yeah, I guess it's like I have a few dog heart rates. Like every once in a while, you catch one puppy who's much lower than another dog, so maybe it's just a coincidence. But yeah, it's a really weird case.
Well, it
It's
just
very
because of
rare.
how long it was. I mean, I know we have ones that don't survive the birth, right? But like
Yeah,
I couldn't. I mean, it was like halfway through the pregnancy, and I thought for sure,
it's
oh, it's
really
probably
weird.
not going to be
Yeah,
a good omen, but I was wrong. So
yeah, it's good.
hey, you
Hey,
know what?
happy
I'll
things.
always take the chance to do whatever I can, and we got them through it. They
Mhm.
did. The cat did great. Kitten still lives with them, and they're all
Awesome.
doing well. You
See,
know.
happy stories. We tell happy
Yeah,
stories too.
no. And that is the thing that's funny with cats too, is that I've spayed a couple that I thought this looked like what we call a mucomutra, which is like not a there wasn't infection, but it was filled
Yeah.
with mucus and
Yeah.
probably would have become one given
Yeah, it's
long
worth
enough.
taking it out. At this point, there's food in there that doesn't belong there. Just
Yeah,
take it
that needs
all.
to go.
Just get
Yeah,
it all out.
absolutely. And then they do so well. And I think there are some myths that I
Mhm.
think maybe we should dispel when it comes to, cats and dogs. I mean, people are always worried they're going to become fat and lazy um, if you spay and neuter them. That's only if you overfeed them and don't exercise them.
Yeah. And there's some great tools on our website with myBalto that you can look
Yes.
into and how to keep your cat's weight down. Because honestly, cats are hard. I'll give you like you can't take them for walks. Some people do, which I think is great and a little odd sometimes, but I think it's great. The cat leashes, good for them.
Yeah.
But it's tough to get cats exercise. There's a lot of great tools on our website you should check out to help keep your cat's weight down because I know it is a challenge. Even with dogs, it's a challenge. But same thing for people. As
Hmm.
Sam mentioned, watch what they eat, decrease the caloric intake, take them for walks, things like
Yeah,
that. It will
exactly.
help.
And choosing the right diet, balance
Yeah.
complete, talk to
Mhm.
your vet if you're not sure. Don't maybe talk to the clerk at PetSmart.
Yeah, they're very nice people. But yeah, actually, and that's maybe something to talk about at some point. Not
I
this
think we
podcast.
should. Yeah, we'll have to do that, a
That'd be an
nutrition
interesting one
podcast.
to go over food types and all that because I'm sure
Yeah.
that'd be a whole bucket of worms that we
Oh, we'll
can.
have to plan that one. I think that's great.
Yeah.
Um, Anything else to add about heat cycles and spay and neuter?
More just at the end, I guess for me, like the stuff that I'll see sometimes towards when they're actually giving birth, we get a lot of phone calls in the middle of the night, like, hey, they know their dog is getting ready, like their temperature's dropped a little
Mm,
bit, which is not true for all patients. Just want to be very clear about that. But about 70% will have a temperature drop. Um, but the biggest advice I can give to most families is leave them alone. That's probably the biggest thing. They start noticing it and they start watching them like a hawk. And I think we all know on a day-to-day basis, like when we're stressed out, our dogs and our cats tend to know.
oh
They're
yeah,
around us a little more, like they kind of know we're having a bad day. They know when you're watching them like a hawk and they're like, is she going yet? Is she ready? Leave them alone. Let them
right.
do their thing. There's very few times that you need to get involved. There are times, obviously, and you can talk to your veterinarian and there's some good resources online, but
Hmm.
usually give them like 12 to 24 hours to do their thing to get ready. And then if they start pushing, it really shouldn't take more than 4 hours for the first puppy.
Hmm.
Cats, I think, are even sooner. But again, I don't see many of those anymore because
No,
they just
cats
don't
just
come
do it
in.
on their own. I mean, it's so
Yeah.
rare, like you said.
Yeah.
I mean,
It's
that was
very
a
rare.
one time. I don't never see anything like that again.
It's crazy.
Yeah.
But yeah, so pretty much like give them time to do it. And if they're contracting for a while and you still don't see anything after a couple of hours, then give your vet a call, but leave them alone. Put a camera in there. That's fine. Just leave them alone.
Hmm.
So
And then when do you tell people, is it still an hour between puppies? Like if it's more than an hour, or do you
I think
say
they
two
say it
hours?
can be up to 2 hours sometimes
Is that
between
what you
puppies, which
said?
is fine. Yeah,
Yeah.
no, it's okay.
Okay.
Yeah, it's like 1 to 2 hours between puppies.
Uh-huh.
But after that point, then you can start paying attention, especially if they're still contracting. And again, another reason to take X-rays with your primary veterinarian ahead of time,
Hmm.
because then you know how many are coming, and that's a big difference. Because
Yep.
uh, I mean, yeah, the cost of X-rays are insane sometimes on an emergency basis,
Yeah.
and save yourself the money. Just plan ahead of time, and it'll save you a lot. I promise.
Yeah, and if you can figure out when you expect this to all happen too, then it won't be a
Mhm.
surprise,
Yeah, yeah.
You
As I
can count
mentioned
the
earlier, I
days.
think it's about
Hmm.
63, 65 days is like the average. So
Yeah.
you're getting close to that time. Take a
Get
look, get some
ready.
X-rays. I'm
Hmm.
not sure when the skeletons are calcified enough on an X-ray, and
45 days, I believe it is.
run there. Okay,
That's off the top of
uh,
my head. So
yeah,
I'm pretty sure it's 45 days. And
sounds about right.
and you can find the heartbeats a lot sooner though.
Oh, okay, nice.
So usually what we'll do if somebody
Mhm.
thinks that their dog's been bred, and depending on the timing, a lot of times I will go ahead and check for heartbeats. You
Nice,
cannot count puppies
very good.
through
Yeah,
ultrasound.
yeah. People tell
Can't
us
do
that all the
that.
time. Like, yeah, the ultrasound is like four of them. Like that means nothing to me. I'm sorry.
Nope. You do your
Yeah,
best, but you can't.
yeah.
No. And then you gotta take some X-rays once you get to that point where you can see their skeletons. And
Mhm.
then I always caution people, we do the best we can counting. It's not
Yes.
perfect.
Oh
I
yeah.
mean, we can be off, but at least you have an idea, because if there was only one puppy and you're sitting there, and or two puppies, let's say, and you thought there were 12, or you know what I
Hmm.
mean, and really only
Yeah.
two, you get my point. But
Yeah. Knowing the
yeah,
number is very helpful because even if you have one or two puppies, that usually means they're be larger puppies. So you might have more problem than someone
yep.
who's got like 10 puppies, waiting to come out. They're usually smaller puppies as a whole just because of resources. So it's something really important to take x-rays early. I think it's a really good idea. And that's something that probably the biggest encouragement I give to all families
Hmm.
because it's probably the biggest expense initially that owners
Hmm.
will face.
Yeah. And also too, talking to your vet, there are certain preventative medications and things like that that you can do when they're pregnant, like keeping them on their flea and tick preventatives and the heartworms that are on label for that.
Mhm.
Again, I don't do a lot of that. So anytime somebody comes in, I always look up the current recommendation. I'll go right on the AHA
Yeah.
website and just look, make sure, or are we up to date on whatever vaccines we can do? Some really shouldn't be done in a cat, pregnant cat. You don't vaccinate, you know.
Yeah.
So it really just it depends. I mean, I really don't do enough of it that I look every time because things change, and if you
Yeah.
don't do something every day, you should always check the current recommendation, and that's what I do.
Yeah, and I think, maybe in the future we can, I'm sure there's one of our colleagues who's more of a specialist of breeding. We can always have them on and kind of talk to them about a couple of things. I'm sure I'd be interested to know more what they see on a day-to-day basis because some people really do specialize in it, and
And
that's,
it's such an interesting thing, and when it's done
oh, yeah.
properly, I mean, it's great, you know, it's
Yeah.
just
It's
it
happy too.
yeah,
You're
it's great. I
bringing
know
life
it's
into
the
the
most fun
world.
part of your day, right? Getting to see
Yeah.
puppies. So, but it has to be done, I think, with everybody's best interest, and you don't want it to
Mhm.
become a tragedy when it can be
Yeah,
such a great
exactly.
thing.
No, I think that's
Yeah.
great.
Yeah. All right. Well, you guys have been listening to the Pause It podcast with Dr. Sam and Dr. Robert. So we're happy to have you guys here. Join us next time where we're going to talk about inappropriate elimination in cats.
It's a
And
favorite topic of mine.
oh, that's a good topic. So stop on by again.
Well, thanks, guys.